how do we know the robot's going to do the right thing? Well, we know already that doctors don't necessarily do the right thing. It's a human mistake.
Gary Mudie is CTO of Babylon, an online doctor and consultation service aiming to make healthcare affordable and accessible to everyone on Earth. He joins us now on Cloud Moves TV. Gary, welcome. Thank you so much for joining us.
Thank you very much.
Now, how does Babylon work, and how can online diagnosis ever be truly accurate?
So Babylon works, first of all, in the format of an app. You download the app. You'll register with us. We take some of your personal information and your medical information. And then basically what happens is a couple of things. One, we can start to triage you through the app. So if you have a condition or if there's something you're not quite sure about, we can start to ask you questions. And then if that requires a consultation with a doctor, what we'll then do is prompt you to book with a doctor. And these are doctors that we employ. We have about 100 doctors now in the UK. And essentially what will happen is you'll have a 10-minute consultation, and we have about 100 doctors. And essentially what will happen is they'll take you through a normal consultation process, as you would expect when you see a doctor face-to-face. Assuming that everything's okay, there's nothing else we need to do. If treatment's required, though, what we can do is give you a prescription. That's also available in our app. What you can then do is geolocate your chemist of your choice or where you happen to be. So for example, we're at Web Summit now. If you happen to be going past the chemist at Lisbon and you needed to pick something up, we can arrange for that prescription to be electronically sent to the chemist. You can then go and collect your medication. So really, you don't need to take any time out of your day whatsoever. You could be at the office, you could be in a conference, you could be doing a TV show, and if you need to interact or speak with any medical professionals, you can do that.
Now, Gary, you've rolled out now on an international scale. How can this benefit third world countries, and when?
So we're already starting early stage project in Rwanda, a first developing country. There's a couple of changes that we had to make with Rwanda, first of all. The smartphone penetration is not as great as in the UK. We're currently about 8-9% smartphone penetration. So we have a feature phone app that connects into the same architecture. But it does a couple of things. So first of all, if you think about in the developed countries, misdiagnosis in consultation is about 15%. In the developing countries, that's as much as 60%, 60. So what we use is our artificial intelligence triage systems to guide both the clinicians and the nurses that are giving the information to the patient. And at a time when the technology evolves and it becomes available on a smartphone app, that same information would be available. But today, the way that service is working is more through traditional call centres on a feature phone. But we're using the technology to sort of guide the nurses through to make an accurate diagnosis. So it's improving the outcomes in the country.
And Gary, how safe is our private medical data with the advent of the Internet of Things?
Yeah, I mean, it's a good question. I don't think it's just medical data. I think it's all data. I think it's really important now that people read T's and C's, and it's difficult because the T's and C's in so many of these devices and applications are so large. But I mean, specifically for Babylon, we don't share data with any providers. We capture key data that we need for you. We connect to a lot of the Internet of Things devices, plus also wearables as well. So we can start capturing how you move, how you walk, what type of food you're eating, how regularly you're sleeping, and we can start to build up a profile. But that's used to drive our intelligence systems to begin to think about how we might start predicting certain conditions that may affect you in the future. But I mean, just Internet of Things in general, I mean, it's something I think people need to be aware of. I think on the whole, all the companies are trying to do the right thing, particularly in health. But what's becoming more evident is us as consumers and owners of these products and devices. It's really our responsibility to make sure that we know where our data is.
Gary, do you think that robots are going to replace doctors and nurses? And what do you think of the argument that some people give in saying it's actually going to be safer because it's going to eliminate human error?
Yeah, I've just had to do a debate up against young Ricardo. And I mean, as I was saying in the talk, we already see a lot of robots in hospitals. I think when people talk about robots, they think of mannequin-style machines or human-like machines. I tend to think more about the systems that are supporting doctors already today. I mean, in terms of the improvements, I think absolutely. I think one of the comments we'd had there was that, how do we know the robot's going to do the right thing? Well, we know already that doctors don't necessarily do the right thing. It's a human mistake, but it's also difficult. We look at the driverless cars, for example, and there was a recent crash which was very difficult, obviously, for people to hear about. But at the same time, we have a lot of crashes that are caused by humans by accident. I think this is all about us as humans learning to let go of control, but at the same time, we completely understand the concerns around letting go too much control. But in terms of, I still predict in certainly 10 years, we'll see a marked change within the hospital environment. And I think it'll be for the positive as well, because there's just not sufficient resource in these places now to cope with all of the demand that's being put upon them, really.
Do you think we're going to see more artificial intelligence diagnosing patients?
Yeah, for sure. I mean, this is one of the core engines in our platform. So we use this now instead of the doctor's time. We will take it one stage further in March next year. This release has all been about making the product a generic diagnosis for the male or the female in a certain age range as well, which is how some of the more traditional systems work. What we're now doing with our system is taking information around, as I was mentioning, wearables, environmental data, your genetic data, your medical records, and this will be used to start building up a profile of you individually, so our triage engines can start to do personal predictions around your health and future well-being.
Wow, and Gary, just one very last question. What would you say to those individuals who haven't been able to attend Web Summit today and are thinking of coming next year? What would you say to those people?
I think definitely come. I mean, I've done Dublin and I've done Portugal. I think Portugal's about 3 times the size when I was in Dublin, and we've got 55,000 people here this year. I think the format of the arenas has just been great. I think a lot of people have said it's actually better than the Dublin one, primarily because you can access so many people quite quickly as well. But I mean, everybody's under one roof. You've got the alphas, the betas, you've got very well established companies out here providing guidance, investors as well, opportunities to meet and talk. It's great. And I think also as well for young entrepreneurs that are out there building their own products, there's a lot of different opportunities to go on stage, pitch, etc. It starts preparing them for the bigger world when they actually have to go out and start raising money and delivering sales.
Gary, thank you so much for joining us. Pleasure to have you on. That's Gary Mudie speaking to us here. I'm Emma Boyle and this is Cloud Moves TV.